Hello, everyone, and a very, very warm welcome to today's webinar. And today we are going to discuss about our recall workshop. What is the plan? How you are going to go with this course and how you can take benefit from this course. Okay. And after that, we are going to discuss some exam strategies, some methodologies, some tips and tricks to ace your AMC exam. And in the end, we're going to discuss about the QA session. So for this webinar, we have Dr. Amtul and Dr. Farhat. Hi, Dr. Amtul. Hi, Dr. Farhat. Thank you so much for joining us today.
Hello, Dr. Asma. Hello, everyone. How are you all?
I hope everyone is very excited for this
Very
recall workshop. And they were also waiting for this orientation session because they have a lot of queries and they wanted to, solve all the queries, what they have in the mind and how you're going to go with the workshop. So let me tell you about our recall workshop.
Yes, so that will be great. So today we are going to help you guys. If you have any question, you can ask us at any time.
So first of all, let me tell you about the features of our recall workshop. So we will be conducting 6 live sessions in which we are going to discuss recall questions. Dr. Amtul and Dr. Farhat are going to conduct those sessions with you. And then we are going to give you the recording of the sessions as well on our website. So whenever the session is conducted on the very next day, we are going to share the recording of the session, okay? And also we are going to conduct some quizzes, some mock exams. So I will share the schedule with you so that you can have a look at how we are going to go with this workshop. So basically the duration of the workshop will be for 4 weeks, okay? And this is the schedule that we are going to follow in this recall workshop. So on today, like on 15th, we have orientation session. And tomorrow we are going to give you a topic test for dermatology, ophthalmology, and ENT. And the topic test will be given on our application so that you can have a real-time experience, okay? So on daily basis, we are going to give you topic tests. And like you can see the schedule, on 19th, we will be having our next live session with Dr. Amtul. On 22, we will be having our next live session with Dr. Farhat. So like this, we're going to go with the flow, okay? Also, we're going to have quizzes, and your first quiz will be on 24th. Your next quiz will be on 31st, and your next quiz will be on 7th. So there will be 3 quizzes conducted in the study group, okay? And in the end of the workshop, we are going to conduct mock exams, and these mock exams will be really like your real exam. There will be 150 questions that you need to attempt. So let me give you an overview about your QBank. Just give me a second so that I can share our website link. I hope you all can see the screen. So this is basically our application. So to access the application, you have to sign up first, create your account and share your account details with us so that we can give you access. Okay, so first you need to log in. So after logging into your account, you will see the website. You have to click on QBank. You will see AMC QBank. You have to click on that. And you can see all your attempts that you attempted. So for example, if you want to practice, you need to click on practice now, and you can see 2 modes. First is the revision mode, and the second is the mock exam mode. So what is revision mode? So when you click on revision mode, you will see different topics. You can select any topic that you want to revise, okay? For example, I want to revise dermatology. For example, I will click on that. And you can select as many topics as you want. Like I can select hematology, nephrology, ethics, whatever I want to revise. Then you have to click on start and it will show you the test, okay? You can see the question, you can see options, you can select the right option. For example, I guess this is the right option. Then it will show you, yeah, this is the right one. It will show you with the green color. And then you can see the explanation of that question as well. So in revision mode, you will see the correct answer with explanation, okay? So after attempting all the questions, like you can see, there are multiple questions. Attempt all the questions, then submit your test. After submitting, you have to save your test. Okay, for example, I will name it as test and save it. And then it will show you the score, how many questions you have attempted, how many questions you have skipped, how many questions you have, answered correctly, how many incorrect answers. And it will also give you an option of retaking the exam. For example, if you think that your test was not up to the mark, you can retake the exam. Okay, you can also see the answers, and you can also click on the dashboard. With this, you will go back to the AMC QBank. Okay, so if I click on see answers, so you can see the first question with the right answer and with explanation. Okay, I guess this is clear to you. So let's move to the mock exam mode. So that you can have a look at how you're going to attempt the questions. For example, if I click on mock exam mode, so what it is, you're going to decide how many questions you need to attempt. For example, I can decide 150 questions. Okay, you can also decide the duration of the test as well. So this is all up to you. You can decide your own options. You can create your own test. You can create, you can choose any topic that you want to practice. You can choose all topics at once, or you can choose, 5 topics, 6 topics, depending on your, preparation. So you can, make your own mock exam as well. So I guess this QBank is clear to you. Let's move to our PPT. Let me share my screen again. So yeah, this was the schedule that we were discussing. So tomorrow you're going to get your first topic test that you need to attempt, and you will be having 24 hours to solve the test. Okay, so you can solve the test any time of your choice. Okay, and after attempting the test in 24 hours, we are going to announce the top scorers in the study group, so that you will get the motivation and to get in the top scorers. Okay, let's move to the next slide. Okay, so for all the students who don't want to, join the recall workshop, we have another option for you, that is the question bank. You can also join our question bank that I have shown you recently. You can, join for 3 months, for 6 months, for 12 months. It all depends on you. Okay, there will be 1,400 plus questions, and with explanation and correct answers that I explained, earlier as well. So this is about our course. Now I would like to request Dr. Amtol, can you please proceed with the AMC preparation tips? I guess you can share your slide, please. I will stop the slide and you can share it.
Hello, good afternoon, good evening, and for someone it's good morning. Everyone, I am Dr. 𝗷𝙁𝙮𝙀𝙁𝙯𝘁 𝙯𝙀𝙯. Is my screen visible to you all?
Yes, Dr. Amtol, it's visible.
Yeah. So I'm Dr. 𝗷𝙁𝙮𝙯𝙯𝙯, and I'm basically from India, and it's been more than a while that I'm in Australia. I am gonna be your mentor for this orientation workshop with med experts. I am a critical care specialist, and as you know, I've done my AMC exam and also ALS and BLS certified. So I'm gonna guide you all through this journey. Me and Dr. Farhat are going to be with you all through this journey, not just teaching, but solving the questions, addressing your queries, whether you need a motivation at any point of time, you are breaking down study-wise, is it mentally, you need a support. We and the team of med experts are always here to help you. So today in this orientation session, I'm going to take the study guide. So how to prepare for AMC. It's definitely like when we are in our internship and when we are doing our final year, we want to move to Australia. It's definitely confusing how to do it, how to proceed with it. So for that, definitely way to start. We have made our first orientation class very clear, pathways to Australia. So first decide which way you want to go. Like you want to go via the standard pathway, or you want a specialist pathway, or you want a competitive pathway. whichever is your choice, just have a clarity where you want to go ahead and know your options. You need to, when you start working for your success, you should know where to go. So always know your options. So have a look at that video where you want to go, and definitely on how to prepare for AMC. Dr. Farhat has done a very absolutely amazing video on that, to how to prepare for AMC. Now, what is this orientation program? What is this recall workshop? The people who have already decided their path, that they want to go via the standard pathway, and they have done their preparations and are going to appear for that exam, this recall workshop is a push for them. So wherever they are missing, wherever you are lagging behind, whether it's in concepts or it's the recent recalls which you want, like some topics which you have not done, they're all being covered over here. So it's an ultimate guide for all the recalls, but definitely for, like, to prepare for an exam, there are a few things that you need to keep in mind. The preparation comes with planning, that you want to plan which pathway you want, how you want to proceed. That's your planning. The next step is preparing. We, the med experts, are here to help you in your preparation. This is the recall workshop for the people who have already have their concepts. But in case you want your concepts to be clear, join our conceptual unlimited workshop, which is a 3 to 6 months workshop where we are going to discuss every concept in detail. But here in this workshop, we are going to mostly talk on recalls. So with our help, with your preparation, you are going to perform and absolutely rock that AMC exam. So always remember, there are 3 P's: plan, prepare, and perform. So this recall is for the people who have planned, prepare, and just that final push, and you're all set to perform in this AMC exam. So moving ahead, this was like what we're going to do, a clarity, like what we're going to do. But how you're going to prepare for it? What are your resources for this exam? Definitely, like many of you would have by now know that you have to study handbook and everything, like so many things. But when you are just, I'm talking today for the people who are going to appear in Feb and March, because there is not much time left where you can read all your concepts like word to word, paper to paper. So I'm just talking about those people who are going to appear in the exam in next 2 months. So first thing mandatory to do is your AMC handbook of MCQs. That is mandatory. And if you have done before, you have to do it once again just before your exam. That's a compulsion. And another book you can go through is Anthropology of Medical Conditions. This book gives you to things differentials. Like if you get a case, suppose if you get a case of shortness of breath, like this book helps you to think, oh, it can be a case of pulmonary embolism. It can be a fat embolism. It can be acute exacerbation of COPD. All that things, it can be an MI, it can be an anxiety. So all that differentials can come with Anthropology of Medical Conditions. But just in case you have not read this book, don't worry. And the another resource is 𝗔 𝗦𝗲𝘀𝗀𝗏, the question bank. We have an absolute fabulous question bank with us. And even if not this, you would have by now practiced doing some question bank, right? So that question bank guidelines, especially from RACGP, which is the Royal Australian College of General Practitioners, that are the standard guidelines which are being followed in Australia. And when you sit for AMC, guys, this is something you need to be very clear about, that they are going to ask what is there in Australia. Like in our countries, we are used to give exams where they ask in depth, like, like at a molecular level, where you need to verify a lot of things. But here, you need to have that thing to apply. How to apply the things, how to use it, how to repeatedly, keep thinking in a variety of way. This can be also possibility. That can be the possibility. How am I going to eliminate my options? That is going to be approach for this AMC exam. So the important guidelines you guys need to remember is RACGP and RCH, which is Royal Children Healthcare. This is very important. And you need to, like, for all the pediatric questions, it's like very good. And definitely up to date, have a very good treatments, like what is being added recently, what is being outdated, what is being not in practice right now. Up to date, help us. And definitely not last but not the least, recalls. Recalls, and I cannot emphasize and mention the importance of recalls. We all know it, how important it is. But remember one thing, guys, like, to get the recalls, you people might be in your FB groups, some might be in Telegram groups. Like at the same time, you are in 4 to 5 groups. You are on a 4 to 5 WhatsApp groups. You are on 4 to 5 Facebook groups. You are 4 to 5 Telegram groups. Like you are just getting that bulk over there. And I know that with that bulk, you're like, oh, what is this? And you are doing nothing. So follow one group, any of your choice, whichever you want. Follow one thing and proceed in that direction. You cannot have multiple directions and one ultimate destination. You need to prioritize where you what you want to follow, which group is good, and do that recalls every day. And something to learn from the recalls is everything is not gonna come as it is. The recalls gives you the concept. Like this was being topic emphasized in the exam. What a recall a person got yesterday, you might not get the same. So don't buttify that answers and go into your exam. You might get a different recall, but different question, but the topic might be the same. So the point to pick up is the recalls emphasizes the important topics, and you have to make yourself perfect in every angle. In whatever direction the question must asked, you should know about the topic. That's what AMC preparation is all about. So these are the books for the final, the thing to hit the arrow. This you need definitely. Okay. Now coming to the AMC handbook. Yeah. It's like anybody wants to say anything? Okay. So coming to the AMC handbook, guys, many of you might be thinking it's outdated. Why to study? See, when you see AMC handbook, it's definitely outdated, but it is the stepping stone. People who are planning to appear for AMC next few months, or who are lost in their preparation and don't know where to start, it's definitely stepping stone. It is going to develop that approach in you, how to go for that question. Yes, it's going to emphasize the important topics which are there in Australia. Might be the answers might be not up to date because the guidelines keep changing. Then this book has not been updated till now. So the treatment protocols might have changed. The investigations might have changed, but the topics it emphasizes are still important. And if you are lucky enough, you will get 1, 2, 3 questions from the handbook just like that, just the same questions. And every single mark matters in AMC. Every single mark matters in AMC. So that is very important. So don't just read don't just read the questions and answers. Read the topics. That's what the message handbook is giving to you. Don't read don't read just this is a question, this is the answer. Read the topics which are being mentioned in that. Okay, guys. Now, I think by now the people who are going to go for their exam have definitely done the handbook for at least one time, and they are supposed to do one more time just before the exam. So how you gonna finish it before the exam? You might be thinking like there are many things to do. There are so many topics to cover and we have already done it. It's similar to revising recalls, guys. So try to do it one more time before your exam. See, the total handbook has 583 questions, right? And if you do 80 questions per day, you are just going to finish that handbook in 1 week. Especially for the people who are going in Feb and March, try to do the handbook one more time. Try to do 80 questions per day. Don't like when you like studying your specific topics and you are done with it, you are going to take that break, have a look on that topic and try to analyze what is there in it and try to approach it. Okay, let me just show you one example, how we gonna read the handbook, or how you're gonna, when you have a time, how you're gonna go through this. So there is a question over here. It's taken from the handbook. It's a 45-year-old man. He was involved in a motor vehicle crash. He was the seatbelt driver of a car stationary at lights when his car was hit from behind by a heavy truck at the high impact speed and pushed into the car in front. He had immediate acute pain in the lower neck, localized to the right upper back above the shoulder blade. So from here, guys, till now it was like how the accident happened. Now the real scenario is setting in. Okay. He had an immediate acute pain in the lower neck, localized to the upper back. Then he was taken to the hospital by ambulance, where X-ray of the cervical spine and shoulder were performed. And at that time, they were reported to be normal without any evidence of bony fracture or dislocation. He was discharged after a period of several hours of observation. Over succeeding days, he developed pain in his right dominant hand, associated with pins and needles and numbness, affecting particularly the middle finger. And he noted that his grip was weaker with the difficulty making a fist. On examination, he had a painful restriction of movement of the leg, particularly flexion and extension. Neurological examination of the upper limb showed numbness in the right palm and on the dorsum of the hand, extending to the middle finger. Grip strength was diminished on the right compared to the left, and the tricep jerk on the left was normal but diminished on the right. Okay, it was a pretty lengthy question though, but it has like a very good thing to know how to approach in handbook. So I've just selected this question. I don't know. I just opened the handbook and this was there. So I just took it for you people. So if you see in the question, he's saying he's having tingling, numbing sensation, and nothing was being showed on an X-ray. So definitely there is no bony deformity. And it's showing towards something of a nerve problem. So they have done an MRI. This is a picture of an MRI, and we have an option such as traumatic 𝗪𝗀𝗻𝗄𝗃 affecting the spinal cord at 6, impinging radiculopathy. Just a minute. Yeah. And epidural hematoma, hemisection, and 𝗪𝗃𝗲𝗃𝗀𝗃𝗀𝗃 injury of the cervical spine. So whenever you read a question, you will have these options. So as per the explanation, you will be like, okay, it's a it's an impingement, but that's not the way you're gonna read and approach. The actual way to approach in this question is first see the MRI picture. You can see something is being trapped over here. Okay, something being trapped over here. What was your first option, guys? Traumatic 𝗪𝗻𝗻𝗄𝗃. 𝗪𝗻𝗻𝗃 means what happens? There will be expansion of the cavity. Okay, 𝗪𝗻 is a cavity, mylia is expansion. So the 𝗪𝗻𝗻𝗃, the cavity will expand. Can you see anywhere there is an expansion of the cavity over here? Can you notice anywhere is there expansion of the cavity? No. So the first option is ruled out automatically. Second thing, can you see an impingement radiculopathy? Impingement might be that might be the possible option. So we are going to hold on that. Next, epidural hematoma. Epidural hematoma, will it look like that? Hematoma will be somewhere on the head and it would be having a profuse bleeding, and epidural hematoma involves what? It involves the blood vessel, right? So when something is involving the blood vessel, it involving the arterial blood circulation. So epidural hematoma will have immediate symptoms. Patient will go into like unconscious and will show the signs immediately. That's why epidural hematomas are very urgent to address. So when you are seeing the options, you are having in your mind, this cannot be there, this cannot be there, this cannot be there. So how it should be the approach. And that's what I was trying to discuss with you. So when you are talking about C7 impingement, so you need to know that in C7, what happens? Wrist flexion, middle finger will be gone, and tricep jerk will be gone. Okay. Finger extension. So have you ever done the tricep exercise? You just do like this. So when you're doing like this for the tricep, what you are doing? You are jerking the tricep, you're taking your hand, and you are wrist flexion you are doing, and you are extending your fingers. So that's what the C7 does. So have that flow in your mind that whenever C7 will involve, the tricep will be gone. Okay. And just remember, when you do your hand like this, I just remember it like that. That's why showing. When you do the tricep exercise, can you see your arm making a number 7 like this? Right? Can you see I'm making a number 7? So C7, tricep will be gone. Tricep jerk will be there. Middle finger will be gone. And finger flexion, wrist flexion, and finger extension. If C7 is tricep, who should be C6? C6 will be bicep jerk and wrist extension, or definitely opposite of that. So wrist extension and bicep jerk. Here in the question, it was just about asked by C7. But when you are talking about tricep, try to immediately study at that time. Then who is responding to bicep? It is C6. So that's what handbook make you to learn. And when one more thing, like whenever like the last one, the fracture it was talking about, the 𝗫𝗄𝗪𝙁 injury. Okay, it's not an option over here, guys, but you need to remember what happens in the 𝗫𝗄𝗪𝙁 injury. That is the actual thing we are going to learn from the handbook. We are not going to just leave, oh, this is not the option, just leave it. No, from that, pick up that word, 𝗫𝗄𝗪𝙁 injury, and read about it. And that might come in your exam. So that's how you're going to read. So from this one question, there are 5 important topics the handbook has given you. Traumatic syringomyelia. So whenever there is an injury, there will be like, injury to your spinal cord because of the blood or pooling inside of the blood. There can be expansion of the cavity, or they can be, the cavity might increase. And this blood even can come from upwards, right? So basically the cavity has expanded. So syringomyelia, traumatic is an important topic. Impingement radiculopathy, C7 is given. Definitely read about C6. Who is doing that? Biceps. So that's a topic. Epidural hematoma, it has given a topic. It has given you a Brown-Sequard syndrome, which is very, very important. Okay, it has given you that. And it has given you 𝗫𝗄𝗪𝙁 fracture. So the handbook has given you 5 topics. Anything can be asked in the exam. That's how you need to read the handbook. Okay, next. So that was my thing on handbook. Like, you have to finish your handbook one more time before your exam. Easy way to do is do 80 questions per day. And when I say you do 80 questions per day, there should be no excuse. You are not sleeping, that's okay. If you're sleeping 1 hour late, that's okay. You're getting up 1 hour early, it's okay. But you need to do that 80 questions and finish that handbook in 1 week. That has to be your target, and you have to achieve it. That's how you're going to pass the exam. So keep your targets very clear. And in that list, add one thing, 80 questions of handbook daily for 1 week, and you are done with it. Now coming to the 𝗁𝗏𝗃 and the guidelines. So I know none of you would have studied 𝗁𝗏𝗃 page to page, and it's not even possible. And you really don't have to read it page to page. And if you haven't touched the book till now, okay. But not every word is important. Not every page is important. That's what I want to emphasize. They say that 𝗁𝗏𝗃 is, the Bible. From that, the question are asked. But it's not like that. Actually, there are certain topics which can be emphasized from 𝗁𝗏𝗃. And from other sources also, you can learn. You can actually have that approach. The same thing is being mentioned. And even if you have not touched 𝗁𝗏𝗃, it's okay. But I would like to emphasize certain important topics from 𝗁𝗏𝗃, that is women's health and autoimmune diseases, diabetes mellitus and cellulitis and infections. This is something very important from 𝗁𝗏𝗃. Like, the questions may be asked, so they might be like according to that. So these are certain important topics from 𝗁𝗏𝗃. And coming to the guidelines, the question bank we are providing, and you would have studied, would definitely be having guidelines from up-to-date RSCGP, RCH. So don't worry about that. But when a guideline is being provided for a question, try to remember it and try to apply it. That's very important. And we, as much as possible from our side, we'll still try to give you the reference from where we have taken an explanation, and we'll try to cover maximum in the recalls. So we will be covering most 𝗁𝗏𝗃 topics and the guidelines so that it can help you. And you don't have to go through them once again, but you have to go through the handbook. I cannot stop emphasizing the importance of the handbook. So I'm just mentioning because I want everybody from this batch to pass your exams and come up with the flying colors. So what to do with the recall workshop, how to use it effectively. Asma has very well explained, what we are going to provide in the recall workshop, how you're going to use it effectively. So here I have just tried to put the things in order so that you can utilize it. So you are going to have a daily topic test, right? Every day they are going to post certain topic tests. So since you have been given the timetable, what topics are going to be done today. Like today, they will give ENT or ophthalmology and rheumatology. You know from the timetable. In the morning, prepare yourself for that topics. From the question bank, whichever you are following, do the same topics subject-wise. Finish ENT, opthal, and rheumatology. I'm just saying for the example, whatever topics of the day, finish the same from the question bank. Write the test in the evening. And definitely don't forget the 80 questions from the handbook. And whatever topic you have confusion in, you got an answer, go through the answers. Even if you are not, if you have gone wrong, just go through the answers. You have studied in the morning, you are writing the test in the evening, whatever time you want to take the test. Think where you are lagging behind, what concepts you are not able to grab, bring it to us, post it in the WhatsApp group or the Telegram group, what doubts you have. We will try to help you out. Like, you know, if somebody in the group already studied, they might give you an answer. And if we find that, like, you know, the topic is like too much getting, like, you people not having the clarity on it, definitely, like today is Monday, right? I have my class on Friday. I will try to discuss that topic in my session. So whatever topics you are posting, which you don't have a clarity or you want, and everybody is having a doubt, and as much as possible, we will try to address in our recall workshop so that none of the stones are left unturned and you all answer that questions, each and every question you want to. We'll try to cover as much topics, important topics possible in the live sessions. And whatever doubts you have, you can ask in the live sessions, and you can even post it in the group later, or something you want us to cover in the next session and you're really not clear it about, you need to post before the class so that we can add it into our coming presentation and help you with that. One important thing is don't cheat yourself. That's the ultimate thing for this success, that you have to do 80 recalls, your 80 handbook questions, you have to study those topics, you have to take the topic test, and you have to assess yourself and become a better version of yourself every day. So that's how you're going to do. Participate in the quiz days. These quiz days are like weekly ones. These are group discussions. So when you participate in a group, like, it always helps you to learn. And that always gives a competition. Oh, my competitor knows this much. I don't know. I need to speed up. So that competition, healthy competition, that's very important. And along with that, you definitely need to participate, and don't take these things like, you know, okay, I have not done test today, I will do 2 tests tomorrow. Don't postpone things. You are like, your exams is in Feb and March. You are not in a state to postpone things. Now you are in a state that where you have to hasten and gear up the things in your life. So do the things as designed by this workshop every day. Take the topic test, take the quiz days. Try by the end of this all the recall workshops, you should able to finish all the syllabus, all the recalls, and be perfect and ready to rock the mock. Whenever is a mock day, you have to appear for the mock, see where you stand, and you should be prepared enough, right? You are writing your final exam. And then you are all set to rock the AMC exam. That's all it requires. I think that's not much. So always remember, success doesn't come from what you do occasionally. It always comes from what you do consistently. And your consistency is the key. And if you want to be successful, you have to be consistent. And most of you might be because of something you might have not studied till now, or might be like, you know, in some problem, or you might be not able to dedicate that much time. But this 30 days, give it and rock it. Even if you haven't studied all these days, make sure you're gonna put in your 100%. We are here to help you. And remember, working hard for something we don't care about is called stress. We don't care about, like, you're just working in, like, you know, just do it. That's called stress. But when you have something to achieve in your life and you are working for it, it's passion. And passion always pays, and it doesn't make you feel stressed out, and it always keep you consistent. So work for your passion, do the hard work, and we are all here to help you. Thank you, everyone. That was a guide from me and a small review on how we're going to proceed. Me and Dr. Farhat are always here to guide you. So stay connected with us. Thank you.
Thank you so much, Dr. Amtal, for this informative session. I guess every query of the students are clear now. So now I would like to request Dr. Farhad, can you please share your PPT?
Yes, hello guys. So let me share my screen.
Yes, Dr. Farhad, we can see your screen now. Now you can start. Thank you.
Yes, thank you. Okay, can you see my screen now?
Yes, Dr. Farhad, we can see.
Okay, great. So this is, hello everyone, my name is Farhad Joyar. I am one of your mentors for this recall course. And I've passed my MCQ in 2021. And I've done SELS, BCLS, PLS, and TLS as well, that course. And currently I'm preparing for AMC Clinical, which I have exam in less than 45 days. I know it's very stressful situation for everyone, and for the exam it is very tough. But please bear with us, and together we will be fine, and we can pass the exam. So this is some basic information about this about MC. So as you know already, because we have discussed it before. So let's see. All right, there are some tips like do not underestimate the exam, and best all also follow the
Dr.
parent
Farhad,
guidelines.
I guess, sorry, Dr. Farhad,
Um,
I guess your slides are not moving. So can you please move back, and then you can, share your slides again?
yeah, one moment.
Yes, yes. Now we can see, yeah.
Okay, but okay, it's the same issue again. Let's okay, I'll try to. So, is it full screen or not?
Dr. Farhad, it's fine. You can, continue.
Okay, great. So there are some tips that are already given by Dr. Amtul, and it was very nice tips, really useful actually. So please follow the tips that is given by Dr. Amtul. So first of all, we do have like some tips over here as well, like be focused and target approach, study all important topics, and also approach each topic following. And etiology, investigation, management, and treatment is very, very important. Okay. So there are some tips from my side as well, like make sure that you make your mind and start as early as possible, and book an exam date after a few months of preparation to push yourself. Once you book the exam, so it means that you work exam date, that it means that you'll work under the pressure, and by the working under pressure, it will be very helpful for you as well, that you can push yourself and make a plan that suits you and possible for you to commit to it. Do not make a plan like study 15 hours a day and you cannot do that, or 14 hours a day and you cannot do that. Some of you can do like 5 hours, 6 hours, but make a plan according to your own timetable. It's very important. And whatever plan you're making, so make sure that you can follow it and stick to it. And choose your resources wisely. The resources has been discussed with Dr. Amtul. Like we do have like 𝗔 𝗦𝗲𝘀𝗀𝗃. So I've written like multiple times because I've done it myself, because I was very afraid of the exam. I had a lot of stress. But if you can go through it once, or the important topics that you can choose from 𝗔 𝗦𝗲𝘀𝗃, that will be important. And handbook is very important. QBank, mock test, and the guidelines such as 𝗪CGP is very important. And try to study at least 6 days a week, 6 to 8 hours per day. With you know how you study like 50 minutes or 45 minutes, take 10 to 15 minutes break, and make sure that you do not study like 3 hours in a row, because you're just wasting your time and you will not remember anything after that. So the brain has a capacity. So the best way to study is like 50 minutes and take 10 minutes break, or 45 minutes, take 15 minutes break. That will be much better. And we are talking about both the quality and the quantity of the study hours. So the next thing is that work on your weak areas, as we say, like if you have problems with pediatrics, so work on that one. And the preparation, how much months do you need to prepare yourself? I would tell you that it will take about 4 to 8 months, but it depends. Some people use like 1 hour. For myself, I spend like 6 months. And identify your weakness and work on it. Flashcards are very important. Use sticky notes is very, very important. For example, there are some questions that you don't know the answer. Either you share it in the group, and also you can write it down on the sticky notes and hang it on the wall, the important topics that you can see it, and daily you can have a quick review of that one. And important thing, turn off your phone while you are studying. It's very important, because you are studying and suddenly you get a call, suddenly you get a message, so you cannot focus and concentrate. It's important to turn off your phone, or just keep your phone away from yourself. Mix things up. So if you study medicine, for example, if you study medicine for let's say 2 hours, so it will be very boring. Then move to another subject, such as obstetric, pediatrics. Just mix them up, and it will be more interesting for you, and it will not be boring anymore. The study group is very important. So so you can have like study group consist of maximum 4 people that you can study, and make sure that you guys study together and help each other, and have a good timetable and discipline, and have a great night's sleep before the day before your exam date. So that's one of the tips that every teachers or every people who takes the exam they give, but most of us will not follow. But it's very important to rest your brain after studying for several months. Okay, so the exclusion method, when you have the exam, so what you do is that you read the stem and look for the key points. It's very important. And when you have noticed the key points, okay, then understand what the STEM wants from you. As Dr. Ahmed mentioned, because we have one topic, from one topic, they can create like multiple questions and multiple answers. So do not memorize the recall. It's very important. Just know the topic and gain the knowledge, and you can solve the question easily. And the next one is like exclude. When you exclude, so for example, the least possible answers. So we will solve some question. I'll teach you how to do that. And I'm sure that you guys already know it, especially those people who have exam in February and March. They have done it already, but we will practice one more time. And okay, so this is all about the exclusion method, and look at your key points and decide which one is more correct and makes more sense. So at the end, if you're left with 2 options, for example, A and D, and you don't know like which one is correct, but just look which one is more correct. Look which one is more correct. So this is how AMC is doing nowadays. Okay, the main resources that you can use: Jon Murdoch handbook, or Blue Book for the pictures, and RACGP website, RCH website. Always look for Australian guidelines, QBank, and good solid recalls. So I'm going very fast because most of them has been mentioned by Dr. Amtul. And now we are going to doing some example how to solve the question. So for each question, I'll give you 30 seconds. Okay. So this is the question. So I'll give you 30 seconds to think. Let me see in the chat box. Write your answers in the chat box, guys. Okay, still no answer in the chat box. Okay, A, good. All right. We have different answers, but still it's good that you guys participate. Okay, very good. It's coming now. All right. So let's see the answer here. For example, okay, you have a lady who comes with her 6-year-old daughter who has rash on her cheeks. She wants to know when she can go to school. So after 1 week, tomorrow, after 2 days, no exclusion needed, after beginning the antibiotics. Let's see. Okay, the correct answer is D. And why D? Because we have a very beautiful chapter in 𝗔 𝗦𝗲𝘀𝗀𝗃 with the table. So this is some information that you can read by yourself about the parvovirus B19 or the slap chick. Okay, so this is the table in 𝗔 𝗦𝗃𝗀𝗃 that you have to look for. It's very beautiful and every information is written here about the exclusion. So as you can see, for measles, we do have like incubation period 10 to 14 days, and we do have like 4 days of exclusion. Okay, so this again, I've put it here for you guys, made your job easier. So we come to our topic, parvovirus B19. Okay, exclusion, nil. So you don't need to exclude any the child from the daycare center or from the school. Okay, good. And this is the rest that you can read it by yourself. So we do have the next question here. So I'll give you 30 seconds again. Okay, very good. Noor, Jael, very good. Imran Munir, very good. Yes. Okay, great. Okay, the answers are coming now. Yeah, very good. So let's see, what could be the correct answer here? Yes, most of you are right. So the correct answer is splitting. So we do have the question here. So I'm not going to read the question because we have to solve some more recalls here today. So, okay, so you have to exclude, for example, acting out. No, it doesn't make sense because she's not acting out, okay? And denial, she's not denying anything. So denial usually it occurs when there is some grief, and repression is subconscious and suppression is conscious. That you will suppress the unwanted thoughts by yourself, and the repression is that you subconsciously repress the thought. Okay, so very good. This one was very easy. We do have question number 3. Another 30 seconds. Okay, very good, guys. All right, let's see the answer here. Yes, the answer is breast cancer. Why? Because first of all, look at her age. She is 68 years old. So any elderly with a breast lump is a breast cancer until proven otherwise. Okay? Because it is very sensitive topic in Australia. Cancer and breast cancer is very sensitive topic. So here is the answer A. And why? Okay, some people may say like, okay, breast cancer is not painful because the lump is painful. It can be painful based on 𝗔 𝗦𝗃𝗀𝗃𝗃. Look at here. Okay, page 1122, 𝗔 𝗦𝗃𝗃𝗃. Inflammatory breast cancer. Inflammatory breast cancer can be painful. All right, so our next question. Another 30 seconds. Okay, I can see the answers are flowing. Very good. All right. Let's see here. Okay. Yes. So we do have a woman with signs of PCOS with BMI of 29 who comes to you for saying that I'll try to conceive for last 6 months, but she was not successful. What is your most appropriate management? Look at here. AMC is using all this type of question all the time. Most appropriate. Most appropriate. So let's see most appropriate. Because we can give metformin, we can give chlomifene citrate. Chlomifene citrate is also correct. Hysteroscopy, I'm not sure about if it's correct or not in this case, but I don't think so. But look at here, weight loss. Look at John Mothok again. The answer is in John Mothok, page 1247. Okay. Weight reduction and exercise restores normal ovarian function in up to 5% of the women with PCOS. Again, here, we have the first line. First line, okay. What is the first line? Weight reduction and exercise. Great. All right. Our last question for the day is, okay, very good. Yes. Okay. The answer is A. Why answer is A? Let's see. First of all, this is just information. This is the picture I've put for you guys to learn. As you can see, we have normal thyroid. That's how it looks for isotope scanning. And we have thyroiditis. Look at here for the thyroiditis, low or absent intake or uptake. And that's what was written in the question stem as well. Okay. And there's some information about subacute thyroiditis that you can read by yourself. You see TSH, low TSH, elevated T3 and T4. That was what was written in the stem. So the answer is subacute thyroiditis, guys. Okay. So okay. So let's see. So there are some questions like I wanted to answer for me. I'll look at the chat box. For the AMC exam, like, do you need to study more than you sleep? I want to see a yes or no in the chat box, guys. Yes, for AMC exam. All right, can you hear me now?
Yes, Dr. Farhad, we can hear you now.
Okay, the voice was breaking, I think. Okay, I just asked, like, for the AMC exam, especially for those people who have exam after 2 or 3 months, is it do you want to study more than you sleep? The answer is yes. We have to study more than we sleep. We need to study 8 hours, 9 hours, 10 hours. We have to sacrifice everything for this exam. If you really want to work in Australia, if you really want to be a doctor in Australia, you need to sacrifice a lot, guys. Sometimes I know that it is very difficult because you need to study for 6, 8 months I really understand because I have been there. Right? Sometimes you feel depressed, you feel overwhelmed, anxious, and even you might cry. But it's okay. It's okay. Just think about your dream that you want to work in Australia as a doctor, and it is part of the journey. So at the end, I just want to tell we have also provided you a timetable and that you can follow. The timetable was shared by Dr. Asma already. So she will share with you guys again, and you guys can follow it. And please have discipline and push yourself. Do not any excuse you not pass it. I know it's a very difficult exam, but there is no excuse to pass not to pass this exam. Okay, thank you. That's for me, Dr. Asma.
Yes, Dr. Farhad, thank you so much for this informative session and your tips and tricks. They were amazing. So let me, guide the other students who have joined us right now. I just wanted to show you the features of our recall workshop. So we are going to conduct again 6 live sessions. There will be quizzes, there will be mock exams. So you will get a proper experience and you can ace this AMC exam with this workshop. So this is the schedule. Who are the students who have joined us right now? You can see we're going to conduct quizzes, we're going to conduct mock exams, we're going to conduct topic tests. So if you have any query, you have any question, you want, guidance for AMC, how to prepare, how much time you require, you can contact me anytime. We are going to share our WhatsApp number so that you can contact us. Okay, so you can also join our Q Bank as well. So this is the announcement for all the students who have joined us today. So we are giving friends discount, what it is basically. So you can join our recall workshop with your study partner or with your friend, and you can get amazing discount offers. You can get discount offer on our recall workshop. You can get discount offer on QBank as well. So contact us and we are going to share all the details with you. Thank you so much for all of you who have joined us today. We're going to conduct these kind of webinars and sessions, very, very soon. And we're going to share links with you so that you can have all the knowledge regarding AMC. Thank you so much for joining us today. Thank you
Hello,
so much, Dr. Farhad. Dr.
Asma, is
Amtal.
it like, yeah, we
Yes,
are not doing the
welcome.
recalls? Yeah, I was like waiting for the recalls to discuss.
Okay, you want to share the recall questions? Yeah, sure.
Mhm.
Yes, please share your screen. We are waiting for your questions.
I'm so sorry to interrupt in between. Like, I was waiting for I just took a lot of time initially. So I just want to give,
No, it's okay. Thank you so much, Dr. Amtal. We were waiting for your questions. You can share your questions so students can solve.
are you people tired or should we end up? I don't know. Let's do just 2 questions, not more.
No. Please, we are not tired. Go ahead, please.
Yeah, okay. So guys, let's get started. So as I told you, the key to consistency is to decide now and work now. So let's start solving from now. So this is a question. Read it and then we're gonna discuss it. I will take a little time, I will discuss it for 3 minutes. So you have 10-20 seconds to answer it. If you people can give me the response in the chat box, that would be very good because your answers motivate me to give my 110%. Please feel free to answer. Waiting for your replies. Okay, that's good. People are answering. Okay. Thank you, Sain, Rishi. Okay. So you all are correct? Okay. Yeah. So this is a 28-year-old man. So he has come to the intensive unit with a fracture of a base of the skull. Fracture of the base of the skull, guys. One thing you never do in the fracture of base of the skull. You never put a Ryle's tube in a fracture of a base of the skull. That's like with one question, we're going to complete so many questions. Just you people will abase. So in a fracture of base of a skull, you never pull a Ryle's tube because the Ryle's tube goes to the brain via the nose. So you never put a Ryle's tube over there. So it's in approximately 24 hours now. And he has developed, this is polyuria. And urine osmolality is 155 and serum osmolality is 352. And he was given an IV fluids 4 hours later. And the urine output and osmolality remain unchanged. Later, he was given 5 units of vasopressin and urine osmolality increased to 330. Which of the following is the most likely diagnosis? Guys, like you people are very good, very correct in your approach. It is central diabetes insipidus. Let's see how we got it. Catch in the question. He developed polyuria. So it's basically an approach to polyuria. His urine osmolality is on a 155, which is on a lower side. But serum osmolality normal is 280. So it's on the higher side. And he was given intrafluids were seized. What that means? He was given a water deprivation. And then what happened? Did anything happen? Nothing happened. Urine output and osmolality remained unchanged. So when you do a water deprivation test, you are not giving water. So what should generally happen? Urine should become concentrated, but still urine having low osmolality, right? So basically, guys, osmolality is like, you add sugar to a water. So the more sugar you add, like, it becomes like a thickened syrup. So that syrup means it's higher the osmolality and lesser the solute. The lighter the sugar particles are there or the sodium is there, it will be more flowy. It will be having lesser the osmolarity. That's how you need to remember. So if water is being not given, what happens if you don't drink water till 3 to 4 hours? You will get a concentrated urine. But did the osmolarity changed over here? No, it's still on the lower side. So you have ruled water intoxication. Next, guys. Now what you have given? Solute overload. If solutes are more, tell me one thing. Will be the urine osmolality 155 or on the higher side? Yes, it will be on the higher side. Why? Because when the solutes are overload, it will be more concentrated urine will be coming to wash it out. So the osmolality is on the lower side. So you have ruled out 2 options. Okay. The third option. Now coming to the another catch in the question is he is given vasopressin. Now why you need to give a vasopressin in this case? Because it's a diabetes insipidus because the osmolality has not increased. How to know whether it's a nephrogenic or a central diabetes insipidus? So let's have a quick 2 minutes approach so that your concepts are brushed up and you don't need to read this topic again till your finals. So when you say polyuria, when the urine output is greater than 3 liters per day, right? And then what you do whenever the patient have an all polyuria, look at the urine osmolality. And if the urine osmolality is less than 100 means he is either drinking excessive water and going to the urine or it is diabetic insipidus, right? It is between 100 to 300. It's also the same. It is coming between diabetic insipidus. And that's what I told you. When it is greater than 300, that means solute overload. It can be hyperglycemia or high solutes. Now you have 2 diagnoses in your mind. One is psychogenic polydipsia and diabetic insipidus. Now to rule out what you do, water deprivation test. That was done in the question that the fluids were seized. And if after that, the osmolarity doesn't change, that means the patient does not pass a concentrated urine. Means in the first place, he was not taking excessive water. That's why he was not able to concentrate his urine. So polygenic psychodipsia is ruled out. Now you have to rule between central and nephrogenic. Now think what happens in central, that there is ADH is being not produced. From where? From the pituitary. The AD has been not produced. And what is happening in the nephrogenic? The receptors are not working, right? The receptors are not working. So when you give vasopressin or a desmopressin nasal spray, what happens, guys? What was the deficiency you are filling up? When you are filling up the deficiency, now body should start concentrating the urine. That's what happened in the question. Do you see? Now what happened? The osmolality has increased. So in the first place, what was there? There was a deficiency. Now taking the desmopressin, the urine is able to get concentrated. So it is a central. If it would have been nephrogenic, even if you give from outside, It's not going to act on the receptors. Here it acted on the receptors and brought the change. But here it's not going to act on the receptors and not going to bring the change. That's why in nephrogenic, what happens? There would be no change, right? There would be no change in the urine osmolality still. But here it has been changed. Now, we are med-expert students. We will go one more step ahead. What we gonna do? You know diabetic insipidus now ruled out. There is one more condition. Central diabetes insipidus and polydipsia. Don't you think primary polydipsia, which is arising from the vein where the patient is having continuous urge to drink the water, both are central now. Both are passing dilute urine. How you gonna differentiate from them? So if you do a brain MRI and you find a bright spot, that is going to differentiate from primary polydipsia. And if it is absent, that is primary diabetic insipidus. So that's how you're gonna add one more. So here we cover two topics. One is polyuria and one is the approach to polydipsia. So polydipsia, how to differentiate between central and the two important central one, primary and pituitary. It's by means of a MRI where you do a pituitary bright spot. And somebody have told SIADH. Why it was the option SIADH, guys? SIADH name itself says syndrome of inappropriate secretion of ADH. What ADH do? ADH concentrates your urine, right? So it's secreted. When it is secreted inappropriately, what will happen? What will happen? There will be more water reabsorption. Urine will not get, like urine will be concentrated more. Now ADH is for absorption, concentration of the urine. So when the urine is getting concentrated more, the urine volume is going to decrease. Urine osmolality will be on the higher side. So when the urine osmolality, first thing, polyuria, okay, fine. What is the urine osmolality? If it is on the lower side, generally you get diabetic insipidus or you get a polygenic psychodipsia. And if it is on a higher side, then you are going to go for SADH. Look at the urine osmolality. That's why the next step is look at the urine osmolality. And then you look at the urine sodium. Now, what is happening? Urine is not coming out. Urine, where is the water? It is in the body. So what is doing? It's causing the dilation of sodium. So it's going to cause dilutional hyponatremia. So you know why is the hyponatremia, guys? Yes, because whatever is the sodium in the body, it's getting diluted because of the excess water. There will be euvolemia. The patient will be not using diuretics. Tell me that when the body's, whatever is there, is getting diluted, will be the osmolarity on a higher side or on a lower side? The serum osmolality will be on the lower side. And the urine osmolality will be what, guys? On a higher side. Why it will be on the higher, guys? Can you tell me? Yes, because it's getting highly concentrated and urinary sodium would be high. So these are the features of SIDH. Now you can say, now tell me, in SIDH, what is happening? Dilutional hyponatremia? Yes. But in dehydration, diabetic insipidus, it is happening? No, we did not talk because the patient is passing the large volumes of water, but he's not in hyponatremia. Coming to serum osmolality, I'm not saying urine. Serum, what happens in SIDH? It becomes diluted, bloated. Person is bloated. He's not passing urine out. He's keeping all water. So serum will get diluted and urine will get concentrated. What will happen in a reverse condition in diabetic insipidus? The serum osmolality increases and the urine osmolality decreases. Serum osmolality, why it increasing? Because body is throwing everything out and the urine is like very dilute, like, yeah. So what will happen? Urine osmolality will be down. So here we have covered centrogenic diabetic insipidus, nephrogenic diabetic insipidus, how you going to approach polyuria, polydipsia, SIDH. You just need to have that concept. Just remember polyuria, see urine osmolality. Whether if it's high, go for SIDH. Then if you are going for SIDH, see one thing, serum osmolality. SIDH means what? Urine should be more concentrated and serum should be diluted. And if for diabetic insipidus, serum should be more diluted and urine should be like more diluted, concentrated. I hope it's clear for everyone. Yeah, I think I went too fast. Okay, so next, let's go to last question. I'm not going to bore you all. Yeah, next question. Can you guys tell me this? Which of the following is not an ECG finding of digoxin? So you have 30 seconds, guys. The answer came already. Okay, whenever you're answering, guys, this is just, like your assessment. Be truthful what you are answering so that, even if you're wrong, you can correct yourself. This is the time, do as much mistakes as you want. Okay. Okay, we got pretty good answer from Rishi, Imran, and Safia, Dilip. Thank you for contributing to the class, Ruhi. Okay, Lizzie, Stephen. Okay, Stephen, you said inverted T waves. Okay, Stephen, let's answer your doubt now. Okay, don't forget it, Stephen. If it come in the exam, I'm gonna message you that you answer it correct or not. So just 1 minute. Okay, so here the answer, many of you have answered it correctly. It's prolonged QT. Okay, it's prolonged QT. So guys, can you tell me what's digoxin? How does the digoxin works? Okay, the digoxin actually, it's act on the sodium and potassium pump. So when it's acting on the sodium and potassium pump, it stops the pump. It works is to control that and decrease the activity of sodium potassium channel. So when sodium potassium decreases, in response to it, what is increasing? Calcium. Okay, and what's calcium is used for? Force of contraction. So it's going to increase the force of the heart. We are just discussing how the digoxin works. And if you remember this, you're gonna answer each and every question. You don't even need to read. Now listen. Now what it is doing, the another action what digoxin is doing, it is increasing the vagal activity. So when it increases the vagal activity, what vagus do, guys? It slows down the AV conduction, the parasympathetic pathway. As a result, what is happening? The rate is gonna fall down, the heart rate. Now tell me, don't see the indications. Just tell me, when it increases the force of contraction, so in which condition do you think it should be used? Where there is a less force of contraction. Who are these people? People with heart failure. The people with heart failure, their heart pumping action is being slowed down. So they are the people who requires increased force of contraction, right? So that's the one indication of digoxin, that is heart failure. Now guys, next, what it is doing, the next thing, it increasing the vagal activity. So when it's increasing the vagal activity, it's decreasing the rate. So when is the rate increase? In tachyarrhythmias like AF, arterial flutter, arterial fibrillations, paroxysmal atrial tachycardias, SVT and all. So what you want? What is there? The rate is 300, 400. What you want at that time? The rate to be controlled. So what is the drug which is going to lower? Digoxin. So you know the indications of digoxin now. Heart failure, tachyarrhythmias. Now you just tell me something you are using in a limited quantity, right? It's good. It's decreasing the heart. It increases the force of contraction. But too much digoxin, what is going to do? It's contracting. Now it stops the heart. So cardiac arrest. It can cause all type of arrhythmias, right? Next thing, Asma, just 2 minutes, I will be done. And the next thing would be rate of contraction. So when it's lowering the rate, right? Slowing down. Can you think the heart goes into bradycardia? Yes, it will go into bradycardia. And bradycardia means heart blocks. So bradycardia and bradyarrhythmias plus cardiac arrest can be one of the thing of digoxin, right? And what it is doing, guys, it's causing Na plus K plus activities. It is stopping it. So what it can lead to? Yes, hypokalemia. So it's causing, so it's not allowing the influx of the potassium. So what will happen? As a result, there would be low levels of potassium in the body because the pump is affected, right? Hypokalemia, hypomagnesemia, Na plus K plus. Okay, just remember calcium is increased, right? So what calcium does? When you have more calcium, what you do? People in a younger have more calcium, they run. So everything runs in the body. Vomiting, nausea, diarrhea, loss of appetite. Heart is running now. Ventricular arrhythmias, heart blocks. Brain is running. It's going into lethargy, disorientation, confusion, weakness, delirium. Just remember, digoxin means it's running because the calcium has increased, sodium potassium pump has been, activity has been stopped. Now, Stephen, your question here, what is there? what is happening over here? Since it is stopping the sodium-potassium delay, now what will happen? This depolarization. QRS stands for, guys, depolarization. You know, ventricular, when they depolarize, when they go pump the blood to the body, this waves happens. So they are going to slowing down this. So when they are slowing down this, guys, this PR interval, will it increase? Yes, because it's going to take time now. So increase in the PR interval, correct, right? And it's going to slow the depolarization, that it's causing the heart to relax now. So it's increasing the heart rate. So that heart will slowly open like a flower, close like a flower, open like a flower. So it's going to cause this delay, and the ST segment will become like a scoop. Like is called as a scoop. When you take an ice cream scoop, when you take a brick and you scoop up an ice cream, can you see? It looks like that. It has taken a scoop, right? And when ST scooping is been done, so what happened? There will be ST segment depression because it has to scoop from it. And so when ST segment is depressing, so what will happen to T wave? It will go down, T wave inversion. And generally, you don't see the U wave. It's like it goes a little bit flat. But now, because of the scoop, something which was down has taken an up. The amplitude of the U wave increases. So, going back to the questions for a second, inverted T waves, yes, because there is a scooping of ST segment. So, when the ST segment is scooped like a thing, so they will be there. ST depression will be there. Ventricular bigeminy, yes, it is possible. Prolonged PR, yes, because it's causing the slow thing. Prolonged QT, you think the QT will be prolonged or it will be short? Yeah. Let's go back to the ECG, guys. QT, from the starting of the Q to the end of the T. Now, when the segment is scooped, when you take ice cream from the ice cream box, will you have the same amount of ice cream or it will become less or a short? It becomes short. So, because it has to be like scooping quick. So, it will be shorting of ST segment. Now you can see all the features. You see starting of the P till the end of the R, there is a prolongation of the PR. ST segment is sacking, depression, inverted T wave, scoop-like appearance, and you can see an amplitude, increased amplitude of a U waves. Classical ECG of digoxin toxicity. So whenever there is a digoxin toxicity, you see this scooped segments. Digoxin, ice cream, scooping, and you just need to remember this. Okay. And how do you manage? Definitely ABC, airway breathing. Stop digoxin immediately. Start the cardiac monitoring because something you use for benefit now can affect the heart. Correct hypokalemia. Monitor the digoxin levels and severe FB fragments. Now, what is the question in the exam? This was all about digoxin. One question we just read. A question can be asked. What can be the ECG changes of digoxin? What cannot be the ECG changes of digoxin? Where does the digoxin act? And how do you manage digoxin? Now, the important point is, when do you use the fragments, FAB fragments, digoxin immune FAB fragments? When this is a very important question. You have to remember this 4 indication. When the dose is greater than 10 nanograms per liter, or in the children, it is 4. And it has it has caused some arrhythmias, or the patient has gone into cardiac arrest, and there is a hyperkalemia where the concentration of is greater than 5.5. Okay, it has stopped the heart, or it has caused arrhythmias in the heart, and when the concentration has greater than 10 in adults and less than 4 in greater than 4 in children, and potassium levels are greater than 5.5. That's how you're gonna approach, read a topic and finish it off in a one go, and that's it. That's from my side, guys. All the very best, and see you all in the next orientation class. That's how we're going to approach all the cases, and see you in the next class on the Friday. Thank you very much, and thank you for bearing with me. Thank you.
Thank you so much, Dr. Amtal. We really love your energy. The way you teach, it's really amazing. And thank you, Dr. Farhad, for all your tips and tricks. And the way you teach is amazing as well. So thank you so much all for joining us today. If you have any question, if you have any query regarding AMC exam, or if you have any query regarding workshop or QBank, if you want to join that, just, text us. Our team is going to help you in your queries. Okay. Thank you so much for joining us today. Bye-bye. Take care.